Physiotherapy, an overview learning points. A physiotherapist restores movement, relieves pain, and promote recovery through exercise and therapy. Physiotherapy support areas like musculoskeletal, neurological, cardiopulmonary, pediatric, and health. They can also specialize in musculoskeletal, neurological, cardiopulmonary, pediatric, geriatric, women's health. Sports starter question. Which health professional is physiotherapy part of? 1. Nursing profession. 2. Doctor's profession. 3. Allied health profession. 4. Medical associate profession. Correct answer is number 3. Allied health profession, because physiotherapists are university qualified practitioners with specialized expertise in their chosen area. What is physiotherapy? Physiotherapy is registered allied health profession. Physiotherapists play a key role in preventing, diagnosing, and treating a range of conditions and illnesses. Physiotherapy is focused on supporting mobility in a number of different ways. Where do physiotherapists work? Physiotherapists can work within local health services. For example, for the NHS in the UK, they can also work for private companies. Physiotherapists work in hospitals, health centers, care homes, schools, local communities, and sports teams. Physiotherapy specialists: musculoskeletal, respiratory, pediatrics, cardiology, neurological, vascular, musculoskeletal. Physiotherapists who specialize in musculoskeletal injuries work to improve the mobility of joints, strengthen muscle, and reduce pain. They promote recovery through hands-on therapy, as well as educating patients about improving mobility. Cardiology. Specialist cardiology physiotherapists may work in cardiac rehabilitation. They support recovery after heart surgery, heart attacks, and other cardiac-related illnesses. They will also provide patient education around healthy living. Respiratory. Respiratory physiotherapy help people with lung conditions such as COPD and cystic fibrosis. They use hand-on techniques and adjuncts to clear chests. This support improves breathing and gaseous exchange. Neurological. Neurological physiotherapists help people who have multiple sclerosis, Parkinson's disease, and strokes. They use their knowledge of the neurological system to provide treatments to enhance lives, support return to previous activity, and reduce complications. Pediatrics. Pediatric physiotherapists work with children to help them develop and learn. They support patients who have multiple issues such as cerebral palsy, developmental delay, and cystic fibrosis. They use their understanding of child development to provide effective treatments. Vascular. Vascular physiotherapists work with patients who have vascular diseases, including peripheral artery disease. They provide rehabilitation to patients with linked complications, e.g., amputation. Thank you for listening.